today. Today we're going to talk about something very near and dear to my heart in light of the COVID-19 as well as the resources we normally provide for people with disabilities. We're going to add to that equation today by giving some information and resources for mental illness, substance use, as well as homelessness. We're going to start with the Substance Abuse and Mental Health Services Administration, the acronym SAMHSA. So you can put that into your Google search. Again, SAMHSA.gov. They offer a series of things for professionals. They offer training. They have referrals for mental illness and substance use for young adults, for people with serious mental illness. They talk in depth about some of the risk of meth, using meth clinics, resources for families coping with mental and substance use disorders, and a plethora of information in addition to offering grants and information about grants. But let's get back to the resource itself. We have the National Suicide Prevention Lifeline, and that telephone number is 1-800-273-TALK, T-A-L-K, and the numbers are 8255. So that is 1-800-273-8255, and again, that's the National Suicide Prevention Lifeline. We also have a national helpline, which I wanted to offer. This is 24 hours, 7 days a week, both resources. That number is 1-800-662-HELP, H-E-L-P. And the numbers are 4357. So again, that's 1-800-662-4357. And when you call the 24 hours, 7 day a week support, they can guide you to whatever resource you're looking for specifically in terms of mental illness, mental health, and substance abuse. So let's get into the next resource. Here in New York City, they use NYC Well. I don't know if, I think I mentioned that before in one of the previous episodes. NYC Well, you can talk, you can text, you can chat, 24 hours, 7 days a week. And the number for NYC Well is 1-888 NYC Well. They also have an apps library, so you can actually log in using an app if you're more technologically savvy than myself. And the one thing I wanted to add is with NYC Well, they're multilingual, so if you have any language barrier, they can guide you to someone who actually speaks your language. So to text NYC Well, you have text 65173. Again, that's 65173 for NYC Well. To call, 1-888 NYC Well. And they also have the feature to chat. So it's free, it's confidential, and it's 24 hours, 7 days a week. And they can also refer you to services and guide you to any supports you need in dealing with trauma, crisis, for people who, it says for relay service for deaf and hard of hearing, you call 711. When you need Spanish language, you press the number 3. When you call the 888 NYC well number. And for Chinese, you press the number 5. So again, the site mentions that they have interpreters available for over 200 plus languages, and you'll be connected with a counselor if you're not knowledgeable about how the service works. You'll be connected with a counselor who can connect you to a translator service. The counselors that they do have on staff are trained to accept calls, again, from deaf, hard of hearing individuals using video relay services. So I just wanted to offer that as well. They offer suicide prevention, crisis counseling, peer support, in addition to short-term counseling via telephone, text, and web, referrals and warm transfer to other services. Again, I mentioned the referral piece, and they follow up to check that you have connected to care and that it's working for you. So that's very, very important. Next up. And again, I just wanted to share that if you have any barriers in reaching any of the services that I'm offering today, you can reach out to the InterConnections Network email account, which is nycinterconnections@yahoo.com, and we can help guide you. Please give us at least 24 hours to get back to you. If you're in a crisis, please contact 311 or 911. The next resource we have is Thrive NYC. That's also another resource out of the office of the mayor. So they offer training and promotes mental health for all New Yorkers, and programs and resources are available. So they offer some additional services. They offer the NYC Well, and they offer information and updates on the coronavirus, as well as they have crime victim advocates, so that's very, very important. They have a feature on the page, Innovations in Mental Health Care Access During COVID-19. So if you need support, not necessarily someone who has been diagnosed with mental illness or serious mental illness, they do have resources. They're offering some counseling for people who are suffering through the trauma of the pandemic. So if you need any mental health direction or support services during COVID-19 as a result of the pandemic, they have that information on the Thrive NYC website. And again, that's THRIVE NYC. And it's a collaboration between 12 city agencies and over 30 innovative mental health programs. So they have free services, which is very important, this piece right here. Free services regardless of insurance and immigration status. So that's very, very important. So let's go to the next resource. We have New York State Office of Mental Health. get in contact with the New York State Office of Mental Health. You reach out at 844-863-9314. Let's find out. They're offering Office of Mental Health Emotional Support Helpline. And again, I gave that number, 844-863-9314. They have some telegroup sessions for people who are overwhelmed and need some mental health support as a result of COVID-19. And they also have grief support, great resources for my professionals who are looking for a way to help. You can get involved as a volunteer as well with the Office of Mental Health. And the website is omh.ny.gov. Again, omh.ny.gov. A lot of the resources I'm providing today, not only for people in need, but for professionals who need to give their clients some direction and support while they're at home. There is a resource. I'm going to give the resource, but right now the resource is currently closed as a result of COVID-19. We have NYC Free Clinic. So if you type that in your Google search, it'll come up as another resource you can use. You should also be using and utilizing your local hospital's psychiatric department. Referrals to Article 28 clinics that provide psychiatry, psychotherapy, psychological and psychosocial evaluations if you need evaluations, and any crisis team or crisis intervention programs. Another resource I have here is NYC Department of Health and Mental Hygiene. They also have a wealth of information and resources for people with disabilities, people struggling with mental health, and a lot of the actual sites are closed again due to the pandemic, but in terms of mental health, if you go to their website, NYC Department of Mental Health and Hygiene. On the website, they have disability-specific resources as a result of COVID-19, information and resources for depression, for teen health depression, for postpartum depression, for schizophrenia, for bipolar disorder. Social services and benefits, we give a telephone number of 888-692-9355. I'll give that to you again, 888-692-9355. Again, that's for social services and benefits, to make referrals as needed. For crisis services, they have a list of Crisis services for mental health, crisis respite centers. They have Community Access Incorporated. That's a crisis respite center. Riverdale Mental Health Association. That's in the Bronx. Services for the underserved. That's Crisis Respite Center in Brooklyn. And Transitional Services for New York. That's a Crisis Respite Center in Queens. So again, just trying to give as much as I can to support you. We have crisis services, mental health, mobile crisis teams. Very important resources. If you cannot get out, they can come to you in a crisis. And that telephone number to make that referral, they also have on their page. This is again New York City Department of Mental Health and Hygiene's page, the crisis team, mobile crisis team's website. And the telephone number to make that referral, 888-692-9355. And if you click on the mobile crisis team's website, you can be directed to the services you need in your borough. They have National Alliance on Mental Illness, the New York City contact information for National Alliance on Mental Illness in New York City. The New York City helpline is 212-684-3264. And they also have a link here for the New York City chapter. They also have a link for the Depression and Bipolar Support Alliance, DBSA. So, very good information. I wanted to offer those things to you. And I also wanted to let you know I did receive some information. They have NA and AA meetings online. So if you're unable to make it out to a recovery group, they do have virtual meetings. If your sponsors and your supports and your team hasn't put out any information, I just wanted to share that with you, that they do have online NA and AA meetings. So please make an effort to get in touch with your sponsor or your group to get more information. But you can also search via Google to access the resource. Call 311 to access the resource. And again, if the InterConnections network can be of any service to you or resource, please don't hesitate to email us. But I always find you can use 311 as a resource and Google for our professionals who are looking for ways to link their clients to different services. Again, please feel free to use the information as provided here today. And any other resources that can be connected to supporting the clients in need. So we're going to go to NYC Gov. I always find using the internet as a viable resource to help guide you, and as I go through it, I can tell you what I did so that you would be able to navigate the same system the same way and get the same outcome. So they do have, an initiative out of the mayor's office. It's the city's Department of Homeless Services. So they do have outreach teams that engage in homeless New Yorkers accessing services and helping New Yorkers in need of assistance. That's for anyone who wants to make a referral. They have drop-in centers, safe havens, and it's called Homestat outreach teams. So they're out there, and it says you call 311 to report a homeless New Yorker in need of assistance, and then they will use the homelessness outreach street team. I believe that's the correct acronym. Street homelessness outreach effort, that's what it's called, to help the individual that you are attempting to assist and find services for. Hope NYC is another resource. That's the initiative to help homeless people. They have resources on nyc.gov for street outreach, veterans, community. And again, you can refer someone using 311 and they will help you navigate the system in accessing the resources specifically for the client you're making the referral for. They also have on nyc.gov through DYCD, Department of Youth and Community Development. That's for runaway homeless youth. And you can always refer someone to the NYC Department of Homeless Services. They have their own initiatives as well, Turning the Tide NYC, and that's to help people who are trying to navigate between shelters, SROs, and of course everyone is pretty much operating in similar fashion in accordance to the pandemic safeguards. So I haven't had any experience in calling the shelters and the Department of Homelessness yet, but I definitely, again, I always say use 311 as a resource. So definitely call 311, but you can navigate through NYC Department of Homeless, VHS, to see what they're offering and what they're willing to do, and get information on shelters, list of shelters, drop-in centers. They do have some that are specifically working with women, some that are working with men only, some that are working with families. So just make sure you're clear about the dynamics of your household. so that they can most definitely direct you to the appropriate shelter space. They give you a list of providers and a list of shelters and what the referral process is in terms of getting into a shelter, so you don't have to sleep on the streets or in an unsafe condition. And I just want you all to have all of the information necessary to ensure that you're safe. And in closing, in light of everything that's going on in the world right now, I thought it was important and responsible as a provider and a resource for people with disabilities to ensure that we included mental health, substance abuse, as well as homeless resources, to make sure that we're covering as many people and helping as many people as possible from the InterConnections network. Again, thank you for joining us. I wish you all the best, prosperity in the future, and again, #stay home.